If you're managing type 2 diabetes, chances are you've heard a lot about carbohydrates, exercise, and blood sugar testing. But there's something equally important that often flies under the radar, and it could be the missing piece in your blood sugar puzzle: vitamins. That's right. Specific vitamins don't just support general wellness, they play a direct role in how your body produces insulin, uses glucose, protects nerve cells, and repairs damage caused by elevated blood sugar levels. In fact, research shows that people with diabetes are more likely to be deficient in key micronutrients, and these deficiencies can silently sabotage your progress, even if you're doing everything else right. In this video, we'll uncover 6 essential vitamins for diabetes that are backed by science and often overlooked. These aren't exotic supplements or expensive formulas. They're fundamental nutrients that help stabilize blood sugar, reduce inflammation, and protect against common diabetic complications like nerve damage, poor circulation, and insulin resistance. Each vitamin in this list has a unique role. Some help improve how your cells respond to insulin. Others reduce oxidative stress and inflammation, 2 major drivers of complications, and a few are absolutely crucial for maintaining healthy nerves, eyes, and blood vessels. We'll break down what each vitamin does, how a deficiency affects your blood sugar, how to recognize if you're not getting enough, and the best way to get it, through food, supplements, or both. And most importantly, we'll help you understand how to use vitamins for diabetes effectively, safely, and in a way that supports your long-term health goals. This isn't about popping pills or following fads. It's about giving your body the nutritional foundation it needs to function at its best. Whether you're newly diagnosed, pre-diabetic, or looking to optimize your numbers naturally, these 6 vitamins could be the simple, science-based upgrade your body has been waiting for. So stay with us, take notes, and get ready to learn how the right nutrients in the right amounts can help you take control from the inside out. Vitamin number 1, vitamin D, the hormone-like regulator. When most people think of vitamin D, they associate it with strong bones and maybe a bit of sunshine. But what they often don't realize is that vitamin D acts more like a hormone than a traditional vitamin, and its role in blood sugar control is profound. Among all vitamins for diabetes, vitamin D stands out for its direct influence on insulin production, insulin sensitivity, and systemic inflammation. Here's how it works. Vitamin D receptors are found on nearly every cell in your body, including pancreatic beta cells, the cells responsible for producing insulin. Vitamin D helps regulate how these cells function and how much insulin they release. It also affects how well your body's tissues respond to insulin, especially muscle and fat cells. When vitamin D levels are optimal, insulin signaling improves, making glucose more likely to be used for energy rather than floating freely in your bloodstream. Unfortunately, vitamin D deficiency is extremely common, particularly in people with type 2 diabetes. Factors like aging, indoor lifestyles, darker skin tones, obesity, and certain medications all contribute to low vitamin D levels. This deficiency has been strongly linked to increased insulin resistance, higher blood glucose, and more frequent complications like nerve pain and cardiovascular issues. In fact, one meta-analysis of over 25 studies found that people with the lowest levels of vitamin D were significantly more likely to develop type 2 diabetes compared to those with higher levels. Another study published in Diabetes Care showed that supplementing with vitamin D improved insulin sensitivity in people with prediabetes and metabolic syndrome. So how can you tell if you're low in vitamin D? Common symptoms include fatigue, muscle weakness, joint pain, frequent infections, or even depression, many of which overlap with diabetic complications. The only way to know for sure is through a blood test measuring 25-hydroxyvitamin D, which your healthcare provider can order. Optimal blood levels are typically in the range of 30 to 60 nanograms per milliliters, though some experts advocate for 40 to 70 nanograms per milliliter in those managing chronic conditions. To raise your vitamin D levels naturally, sunlight is the best source. Just 15 to 20 minutes of direct sun exposure to your arms, legs, or face several times per week can boost your levels. especially in the spring and summer. But for many adults, especially in northern climates or those who spend most of their time indoors, sunlight alone isn't enough. That's where food and supplements come in. Vitamin D is found in fatty fish like salmon, mackerel, and sardines, as well as in fortified foods like dairy products, plant milks, and some cereals. Still, it's difficult to get sufficient amounts from diet alone, which is why vitamin D supplementation is often recommended, especially for those with diabetes or prediabetes. Most adults benefit from 1,000 to 2,000 IU per day, but those with severe deficiency may need higher doses under medical supervision. Be cautious with very high doses, as vitamin D is fat-soluble and can build up in the body over time, potentially causing toxicity. Among all vitamins for diabetes, vitamin D may be the most underrated yet essential. It doesn't just support bone health, it helps regulate your entire metabolic system, from insulin production to immune response. So if your numbers aren't budging, your energy feels low, or you're battling chronic inflammation, it might be time to check your vitamin D and give your body the hormonal support it needs to manage blood sugar more effectively. Vitamin number 2, vitamin B1 thiamine, the nerve and vessel protector. Often overlooked but absolutely essential, vitamin B1, also known as thiamine, plays a crucial role in how your body converts carbohydrates into energy. But for people with type 2 diabetes, its importance goes far beyond basic metabolism. Among the many vitamins for diabetes, thiamine stands out as a powerful protector of nerves, blood vessels, and organs, areas that are especially vulnerable when blood sugar is elevated. Here's the problem. Studies have consistently shown that people with diabetes are far more likely to have low levels of thiamine, even if they're eating well. High blood sugar causes the kidneys to flush out more thiamine through urine, creating a deficiency over time. And the consequences of low thiamine can be serious, especially when it comes to diabetic complications. Thiamine is essential for the health of the nervous system, particularly the peripheral nerves that send signals to your hands, feet, and organs. Without enough thiamine, these nerves become damaged, leading to symptoms like tingling, burning, numbness, or sharp pain. Classic signs of diabetic neuropathy. It also supports the health of blood vessels and capillaries, helping to prevent the thickening and stiffness that can impair circulation in people with long-standing diabetes. Beyond nerve protection, thiamine also plays a role in preventing kidney and eye complications, which are often linked to oxidative stress and poor blood flow. It acts as a natural antioxidant and helps remove byproducts of glucose metabolism that can damage tissues when they accumulate in excess. So how can you make sure you're getting enough thiamine? Good food sources include whole grains, legumes, seeds, pork, and fortified cereals. However, cooking and food processing can destroy much of the thiamine content, making it difficult to rely on diet alone, especially for people with chronic conditions. For that reason, supplementation is often recommended, particularly in the form of benfotiamine, a fat-soluble version of B1 that's better absorbed and more effective at reaching nerve tissue. Clinical studies have shown that benfotiamine supplementation can reduce symptoms of diabetic neuropathy, improve vascular function, and even help slow the progression of kidney damage. Typical doses for therapeutic use range from 150 to 300 milligrams per day, but always consult your healthcare provider before starting any new supplement, especially if you're managing multiple medications. Among all vitamins for diabetes, thiamine may not be flashy, but it's foundational. It protects the systems that diabetes threatens most and supports the smooth flow of energy and circulation throughout your body. If you're experiencing fatigue, nerve pain, or early signs of complications, it may be time to consider whether your body is getting the B1 it needs, not just to function, but to heal and thrive. Vitamin number 3, vitamin B12, the energy and nerve shield. Among the most vital yet frequently underappreciated nutrients for people with type 2 diabetes is vitamin B12. Known for supporting red blood cell production and energy metabolism, vitamin B12 also plays a critical role in nerve health. a function especially relevant to those with long-standing or poorly controlled blood sugar. What makes B12 particularly important is its ability to protect and repair the myelin sheath, the outer coating that insulates nerve fibers. When B12 levels drop too low, this protective layer begins to break down, leading to nerve dysfunction. For people with diabetes, this often presents as numbness, tingling, burning, or sharp pain in the hands and feet, classic symptoms of peripheral neuropathy. Unfortunately, people with type 2 diabetes are at higher risk of B12 deficiency, especially those taking metformin, one of the most commonly prescribed medications for blood sugar control. While metformin is effective, long-term use can interfere with B12 absorption in the gut, leading to gradual and often unnoticed depletion. This makes B12 one of the most essential vitamins for diabetes, not just for nerve protection, but also for preventing fatigue, brain fog, and mood disturbances. B12 is crucial for energy production at the cellular level, so low levels can leave you feeling drained even if your blood sugar is well managed. B12 deficiency can be subtle, and symptoms may develop slowly over time. In addition to nerve-related issues, signs of deficiency include weakness, memory problems, dizziness, and even mild depression. If left untreated, severe deficiency can cause irreversible nerve damage. The best way to know your B12 status is through a simple blood test. While the typical range is 200 to 900 pg/ml, levels below 400 pg/ml can begin to cause neurological symptoms in sensitive individuals. Vitamin B12 is found naturally in animal products such as meat, eggs, dairy, and fish. For people on plant-based diets or with absorption issues, supplementation becomes essential. B12 is available in oral, sublingual, under the tongue, and injectable forms. Among the most effective forms are methylcobalamin and cyanocobalamin, with methylcobalamin often preferred for nerve-related conditions. For those on metformin or experiencing nerve symptoms, typical supplementation ranges from 500 to 2,000 milligrams daily, depending on individual needs and absorption. It's water-soluble, so excess amounts are generally excreted, but always consult your healthcare provider for personalized advice. Among all vitamins for diabetes, B12 offers a powerful shield against one of the most debilitating complications, nerve damage. And unlike many interventions, this one is safe, affordable, and easy to implement. If you're experiencing fatigue, tingling, or just want to support long-term nerve health, vitamin B12 may be one of the simplest and most effective places to start. Vitamin number 4, vitamin C, the antioxidant that tames sugar damage. When most people think of vitamin C, they think of immune support or citrus fruits. But its role in blood sugar management is far more significant than many realize. Among the most versatile vitamins for diabetes, vitamin C stands out for its ability to protect blood vessels, neutralize sugar-induced oxidative stress, and improve overall metabolic function. High blood sugar doesn't just sit quietly in the bloodstream. It causes damage over time by increasing the production of free radicals, unstable molecules that attack healthy tissues, particularly the lining of your blood vessels. This oxidative stress is one of the main drivers of diabetic complications, from heart disease to kidney damage to retinopathy. That's where vitamin C comes in. Vitamin C is a potent antioxidant that helps neutralize these free radicals and reduce systemic inflammation. It protects cells from damage and helps maintain the integrity of blood vessels, especially the small capillaries that carry nutrients to your nerves, eyes, and organs. For people with type 2 diabetes, whose blood vessels are constantly under attack, this protection is critical. But vitamin C does more than defend. Research shows it may also improve insulin sensitivity and reduce blood sugar levels directly. One study published in Diabetes, Obesity, and Metabolism found that people with type 2 diabetes who took 1,000 milligrams of vitamin C daily for 12 weeks experienced lower fasting glucose and improved A1C. Another study observed that vitamin C can help reduce post-meal glucose spikes, particularly in individuals with elevated oxidative stress. Vitamin C is also vital for wound healing, which is often impaired in diabetics due to poor circulation and slow tissue regeneration. By promoting collagen production and immune response, vitamin C speeds up recovery from minor cuts, ulcers, and infections, making it a must-have nutrient for long-term diabetes care. Getting enough vitamin C from your diet is absolutely possible. Rich sources include citrus fruits, bell peppers, strawberries, kiwi, broccoli, and Brussels sprouts. However, because stress, illness, and inflammation increase your body's demand for vitamin C, supplementation is often considered, especially in people with diabetes. The recommended daily intake for adults is 75 to 90 milligrams, but therapeutic doses range from 500 to 1,000 milligrams per day, depending on your needs. It's water-soluble, so your body excretes what it doesn't need, but high doses, over 2,000 milligrams per day, can cause digestive upset or kidney stone risk in susceptible individuals. If you're managing type 2 diabetes, adding more vitamin C to your daily routine is a smart and accessible way to support your body's defense systems, enhance insulin function, and reduce the long-term damage caused by high blood sugar. Among the many vitamins for diabetes, vitamin C may not regulate glucose directly like insulin, but it protects your body from the damage glucose can do, and that makes it an essential part of any smart diabetes care plan. Vitamin number 5. Vitamin E, the cellular guardian. In the world of blood sugar management, protecting your cells from damage is just as important as lowering glucose levels. That's where vitamin E comes in. Known for its potent antioxidant power, vitamin E is one of the most essential yet underused vitamins for diabetes, particularly when it comes to protecting blood vessels, nerve cells, and organ tissues from sugar-related damage. Vitamin E isn't a single nutrient. It's a group of fat-soluble compounds, with alpha-tocopherol being the most active form in the human body. Its primary function is to neutralize free radicals, the unstable molecules that form in response to high blood sugar, poor diet, pollution, and stress. When free radicals accumulate, they cause oxidative stress, a major contributor to inflammation, insulin resistance, and diabetic complications. For people with type 2 diabetes, this oxidative stress often shows up in the form of damaged blood vessels, increased plaque formation, and deteriorating nerve function. Vitamin E helps break this cycle by stabilizing cell membranes and reducing inflammation throughout the body. This protects your cardiovascular system, enhances circulation, and supports better glucose delivery to your tissues. Several studies have shown that people with diabetes often have lower levels of vitamin E, especially those with poor glycemic control. In fact, vitamin E deficiency has been linked to increased insulin resistance, higher cholesterol, and a greater risk of complications like retinopathy and neuropathy. Supplementing with vitamin E may help improve insulin sensitivity, reduce LDL oxidation, and slow down the progression of blood vessel damage. Vitamin E also plays a role in immune support and cellular repair, which is vital for those dealing with slow wound healing or frequent infections, two common issues in diabetes management. Its fat-soluble nature allows it to integrate into the cell membrane, acting as a line of defense where the damage often begins. You can find vitamin E in a variety of foods, particularly nuts and seeds like almonds and sunflower seeds, spinach, avocados, olive oil, and whole grains. However, dietary intake alone is often not enough to reach therapeutic levels, especially if you're under chronic stress or dealing with existing complications. When supplementing, most adults benefit from 100 to 400 IU, international units, per day, though higher doses should be taken with caution and under medical supervision. Very high doses may interfere with blood clotting, especially if you're taking anticoagulant medications. Among all the vitamins for diabetes, vitamin E stands out as a protector, not just of your sugar levels, but of your entire cellular system. It doesn't just help you feel better today, it helps you stay protected tomorrow by preserving the integrity of your body's most vulnerable systems. So if you're looking to build a long-term defense against diabetic damage, don't overlook this fat-soluble antioxidant. It's not just a vitamin, it's cellular armor. Vitamin number 6. Vitamin K2, the unsung hero for insulin sensitivity. Among the many nutrients that support metabolic health, vitamin K2 is perhaps one of the least understood and most overlooked. While most people associate vitamin K with blood clotting, few realize that vitamin K2 plays a completely different role. It helps regulate insulin sensitivity, blood sugar control, and vascular health, making it one of the most promising emerging vitamins for diabetes. Vitamin K2 works by activating a group of proteins that manage calcium placement in the body. One of these proteins, osteocalcin, not only strengthens bones, but also plays a direct role in improving how cells respond to insulin. Research shows that osteocalcin, when activated by vitamin K2, can increase insulin production and enhance glucose uptake by cells, especially in muscle and fat tissue. This means better blood sugar regulation and less insulin resistance. Another key benefit of vitamin K2 is its ability to prevent arterial calcification, a serious risk for people with diabetes. High blood sugar accelerates calcium deposits in arteries, leading to stiffness, hypertension, and increased cardiovascular risk. Vitamin K2 activates a protein called matrix GLA protein, MGP, which prevents calcium from being deposited in blood vessels and instead directs it toward the bones, where it belongs. In a large population study, individuals with higher intake of vitamin K2 were found to have significantly lower risk of developing type 2 diabetes, as well as reduced risk of coronary artery disease, two conditions that often go hand in hand. So why is K2 often overlooked? First, it's not the same as vitamin K1, which is found in leafy greens and primarily supports blood clotting. Vitamin K2 is found in fermented foods, especially natto, a Japanese fermented soybean dish, hard cheeses, egg yolks, butter from grass-fed cows, and some organ meats. These aren't always common in modern Western diets, making deficiency more likely. Supplementation may be especially beneficial for people with type 2 diabetes or those taking long-term medications that interfere with vitamin K absorption. The two most studied forms of K2 are MK4 and MK7. MK7 has a longer half-life and is better absorbed, making it ideal for daily supplementation. A typical dose of MK7 ranges from 90 to 200 milligrams per day. Though it's important to speak with a healthcare provider if you're on anticoagulant therapy, as vitamin K can interfere with blood-thinning medications. As part of a comprehensive approach, vitamin K2 doesn't work in isolation. It works best alongside vitamin D, magnesium, and a healthy, balanced diet. Together, they create a synergistic effect that improves calcium metabolism, reduces inflammation, and enhances glucose control. Among the many vitamins for diabetes, vitamin K2 might be the quietest player. But its benefits are too powerful to ignore. It helps protect your arteries, optimize insulin function, and reduce the risk of long-term complications, making it an essential part of a smart, prevention-focused diabetes plan. Now that you've learned about the 6 most powerful vitamins for diabetes, one thing should be clear. Blood sugar control isn't just about avoiding sugar. It's about providing your body with the right support at the cellular level. Each of the vitamins we've covered, vitamin D, B1, B12, C, E, and K2, plays a unique and vital role. They support more insulin function, protect your nerves, strengthen your blood vessels, fight inflammation, and even reduce the risk of serious complications like neuropathy and cardiovascular disease. These are not fringe supplements or marketing gimmicks. They are evidence-backed nutrients that many people with type 2 diabetes are missing without even realizing it. And the good news? You don't need to take a dozen pills or chase the latest health trends. You simply need to be informed, consistent, and willing to make small upgrades to your routine. Whether that's adding nutrient-rich foods, talking to your doctor about blood tests, or supplementing smartly where needed. This is how real, lasting change begins. Not with fear, but with knowledge. At Active Healthcare, we believe in empowering you with science-based insights that are easy to apply. If this video helped you understand the role of vitamins in managing type 2 diabetes, we encourage you to subscribe, like, and turn on notifications so you won't miss any of our upcoming content. We cover everything from nutrition and supplements to lifestyle strategies that support healthy aging, stable energy, and better metabolic health, no matter where you're starting from. And we'd love to hear from you. Which vitamin on this list surprised you the most? Which one are you going to focus on first? Leave a comment and share your thoughts. Your story might just help someone else take the next step on their health journey. Remember, diabetes is not just a number on a blood test. It's a signal that your body is asking for better care, deeper nourishment, and smarter habits. These vitamins for diabetes are just one way to respond with wisdom, not worry. Start small, stay consistent, and let your next step be powered by knowledge and supported by real nutrition.